Hello, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder. I'm also the one who wrote the Sweet Session, which I'm going to provide an instructor demonstration for you today. This Sweet Session should only be executed by licensed massage therapists and those who have been through formal healthcare training to touch clients. That's because you should screen your clients for precautions and contraindications prior to providing service. Usually, the Sweet Session is provided for people who are medically compromised. So it's regularly provided in hospice situations, with oncology clients, with geriatrics and advanced prenatal conditions that are contraindicated for regular massage, and even for clients with AIDS who are in a very advanced stage and there's a lack of skin integrity. Sweet sessions are usually great sessions to provide for people who might be contraindicated for regular circulatory massage. Maybe they're in acute organ failure or they have some other circulatory dysfunction that does not allow them to have regular traditional Swedish massage. You might be able to do a sweet session instead. We do teach this course in a full entire CE format. It's called Hospice Massage at our school. And this is our website, ceinstitute.com. To find more videos like this in training, if you scroll down on our homepage, we have social media icons at the bottom left of the page. And there you'll find other YouTube videos from us, lots of more instructional free training videos online. We also have a Facebook and other social media, such as Instagram and Twitter, where we try to continue to provide free training opportunities for our students. So we hope you enjoy this instructor demonstration of a sweet session. So this is what your sweet session looks like. Your client is starting face up supine. I have them on a massage table and we are lying on a pillow here. So we're going to start step one, our bilateral hand hold over the head. This is crown comforting. Okay. Keep in mind, I've already done an intake with this client, and you should never practice your sweet session unless you've completed all the medical training that would be required to rule out contraindications and precautions and so forth for each medical scenario. Anybody could practice a sweet session. Literally, they're very easy to practice, but having that medical knowledge is essential to ensuring you're doing no harm. The crown holding in each holding position here can be as little as 20 seconds to 2 minutes, depending on how long you're providing your appointment. You can also do verbal affirmations during any of the hold positions. I usually like to have the client take a deep breath, inhale all the positive, exhale all the negative. And that's one easy verbal affirmation you can use if it's within your scope of practice to do so, and you feel comfortable and confident using your verbal affirmations with that client. You would usually discuss the practice of verbal affirmations prior to starting your session. So this is step one. Step two, we're going to go into a bilateral handhold of the head. So I'm going to turn the head to one side, place my hand underneath, turn the head to the other side, place my hand underneath. And I'm just going to hold that head. The client's head should be fully relaxed, all the weight into your hand. Okay. And this is another comforting position for the client where you can practice stillness, relaxation, peace, take that mental vacation that they deserve, allow them time and space to enjoy being here, being present, being in their body. And you can practice some more deep breathing with them. And you can create verbal affirmations and practice those if it makes sense for that client as well. Now you'll notice that this client is pretty bald. Step three, we could do finger combing. And when you have maybe a cancer patient who's had chemotherapy and lost most of their hair, or what have you, and you can't finger comb, you can just do some scalp massage over the scalp if the client wishes. So we're practicing some deep breathing here, releasing that head hold. We're just doing some body brushing over the scalp. We do a body brush like this over the feet. I believe that's in step 22 of our sweet session. This is just a nice, enjoyable brushing of the scalp, or you could do scalp massage and manipulate the scalp if you'd like. Whatever makes sense, whatever you feel is going to be the most relaxing, the most enjoyable for your client without doing any harm, that's going to be what you will want to achieve. So this is step 3, your scalp treatment. Again, you would do this as long as you feel would be appropriate. In this case, we're doing a 30-minute appointment. So you would time out each stroke to create a full 30-minute session. You can do sweet sessions anywhere from 20 minutes to 60 minutes or longer. I like booking the 30-minute sessions because, if you want to go longer and you have the time, you can. But if somebody's not well enough to keep their 30-minute session, it's not a real hardship in my schedule. So this is what I call the money sign, rubbing my fingers together. It's like making money, right? And I'm going to do this with the ears, the pinna in between. Okay. So this is step 4, our ear massage. You can use lotion or you can practice this dry and actually scoop in and do a scissor like around the ear to really manipulate the ear here. And then go back to my money signing of the ears. So however you want to massage the ears, that's your choice. And you don't necessarily have to do these steps in this order. If you want to mix up the order a little bit, that's appropriate as well. You can customize this in any way that you feel is appropriate. You could go right back into scalp massage here, and alternate back and forth between ear and scalp, whatever you feel is going to work best for your appointment to make it the most enjoyable for a client. Now, step 5 is we're at the bridge of the nose. I call this like the third eye clearing. So we're walking our pinkies and then our middle fingers and pulling backwards. So it's pinky, middle finger, flexing pinky, flexing middle finger, flexing pinky. And it's just like a finger walking. And when people do this to me, it's just like really clearing of the mind. Okay. Sometimes women love it because they might be wrinkled here with an 11 or 111 or a 1. That's kind of what we call these wrinkles. Sometimes, so they kind of feel like that's getting worked out as well. But I feel like it's just really relaxing to pull up and through the third eye. And that's one way you can manipulate that. Again, you can put a little dab of lotion here if you want to do that pinky middle, pinky middle, pinky middle, pulling through the third eye. This is your 6th chakra up here between the eyes. And it feels really nice. I'm working a little bit further down the bridge of the nose, moving back up to the third eye. And going right into temple massage. Your temple massage is number 6 on your protocol. And you can do this clockwise and counterclockwise, maybe 3 to 10 rotations in each direction, whatever makes most sense for you. Again, you're usually scheduling your sweet sessions for a specific time allotment. So whether it's 20 minutes, 30 minutes, 45 minutes, 50 minutes, 60 minutes, and then you're going to do each stroke for a length of time based on how much of an appointment, how long of an appointment you have booked. Okay. So now I'm going to go into facial acupressure. Okay. And this is number 7. I'm actually just holding up near the bridge of the nose. And then I'm going to do the side wall of the nose and the middle of the nose. Just pressing, and you can press 20 seconds to longer if you wish with each acupressure point. You can do the points that we're suggesting here, or you can do the points that you'd like to do if you have others. You can also do around here in the corners of the nostrils. Okay. It's up to you. And you can skip any of these steps if they don't make sense for your client either. Now we're doing an acupressure point underneath the zygomatic cheekbones here. And we're coming up and repeating again up here at the bridge of the nose. I'm going to do light pressure here, maybe about 1 to 2 pounds of pressure. We're using the finger pads, not the fingertips. And back to the sides of the nose. And then down to the corners of the nostril. And then underneath the zygomatic. Nice, easy, very light pressure application. This is great for anybody who has sinus issues, somebody who has allergies, maybe they're an asthmatic, in addition to whatever other medical illness might indicate them to have a sweet session. I'm passing through the same acupressure points, facial acupressure points, for a third time now. This is our third time applying each pressure point on the face. And from there, we're going to go right into some bone tracing. And what I'm doing is I'm making a V between my thumb and my pointer. And you just saw me slice my hand through that as well. We're going to make that V and we're going to bone trace along the mandible. So you can do this simultaneously or alternating, like you see what I'm doing right here. Your bone tracing is step 8. This usually feels really nice. You might see people's lips turn upwards as they smile and enjoy the bone tracing. It's kind of a nice way. If people have facial hair, you can still kind of go through the beard and pull back. Okay, you can also use lotion to do this. And from there, now I'm just going to place my hands over the shoulders. Okay. I'm very medial to the deltoids, but you can also be out over the heads of the humerus, on the sides of the deltoids. The key here is to have the fingertips facing inferiorly towards the feet. This is like a shoulder comforting. Okay, it's another placement, another hold. They're similar to some of the Reiki holds that you might practice if you're a Reiki practitioner. Okay, this is step 9 in your protocol. And when you're doing your holds, you can have your client practice some more deep breathing. I might say, let's do some deep breathing now. Let's inhale and exhale. And when I exhale, I will turn my head away from them because you don't want to breathe directly on your client. And you can also, the verbal affirmations, you can do the energy clearing of inhaling with positive and exhaling with negative, or any other affirmation that you feel is appropriate. From here, we're going to go into a heart hold or heart comforting. We've put our pointer and middle finger tips together. We're going to be underneath the clavicle, but below the breast tissue. And we're going to hold that heart position. And I feel that this is very comforting for most clients. Most of these holding positions would be comforting. This is number 10, step 10 on your sweet session protocol and sequence. And an example of affirmation that we have for life for the sweet session heart hold would be, my heart is happy. I love the world and the world loves me. And I usually repeat these affirmations 3 times. So my heart is happy. I love the world and the world loves me. My heart is happy. I love the world and the world loves me. And that's an example of a verbal affirmation I would do right here during the heart comforting. Now I'm going to stand up and move my chair to the side of the table. Okay. This is a whole body treatment where we're working from the client's head to the feet, just in the supinated position, and they will stay dressed while they're on the table too. From here, I'm going to do a hold over the abdomen. Okay. In this case, I'm just have one hand over the abdomen and a second mother hand contacting the client. You can also do one hand over the other on the abdomen. There's many different variations you can do of whatever makes sense for you and your client. Now, I really love asking a client to take some deep breaths while you're holding their abdomen. It's usually more effective and the most effective to get a client to practice deep breathing during the abdomen holding and comforting. So you might have the client take a nice deep breath in here and exhale. And that deep breathing usually is very relaxing on its own. And think about all that oxygen, the new oxygen you're going to get into the body, how healthy that might be for somebody who's breathing really shallowly and holding their breath a lot. Maybe they're in a lot of pain. Hopefully that's going to be comforting for your client. So that was number 11, holding the abdomen. Now I'm moving the cameras about a little bit because we're going to start number 12, which is your hand massage. I'm getting some lotion to do the hand massage. I also call this a hand moisturizing session. When I practice the hand massage, I want to use a low pH cream. I never use oil. I don't want my clients' hands greasy. I'm using my thumb pads to work in between the client's metacarpals here. Back and forth, tracing along those longer bones. And now I'm just doing a money sign up each finger and making sure those fingers are massaged as well. If you're working on an oncology client, they might have hand-foot syndrome, which is also known as palmar plantar erythrodysesthesia, which leaves the hands red and chapped. If the skin integrity is still there, if it's not completely compromised, usually a little bit of moisturizing with that hand-foot syndrome would feel really nice to the client. But you would want to wipe off any excess moisture from the client's palm, because heaven forbid they want to grab something, we don't want it greasy and for them to slip. Now I'm placing my pointers between the client's thumb and pointer and ring finger, and I'm doing a little bit of circular friction. You can also interlace fingers, one hand over the other, and do some circular friction with your thumb pads. This usually feels really nice, and it gives a nice little extension and stretch to the carpals too. You can just see me working around in circles with my thumb pad. Now I'm using both hands. Now I'm going to turn the hand over and supinate the client's hand, and we're going to place our pinkies between their pinky and ring finger and thumb and pointer, and we're going to use our thumb pads again to do some nice circular friction here in the client's palm. Hand massage can be really effective. It feels nice. It's a safe area to work. Usually people are comfortable with hand massage. And just giving a once over to the hand, getting that lotion and cream really worked in. And there's your hand massage. The length of time that you're going to do your hand massage will be based upon how long of an appointment you're practicing for your sweet session. So you would do a shorter hand massage if you're doing a 20-minute sweet session, and a longer hand massage if it's, a 50 or 60-minute sweet session. You'll determine how long, and you'll be watching the clock too to make sure you're not under or over, and you're providing the exact time length of the appointment that you've sold. We're going to do a fairly identical hand massage to what we practiced on the first hand. We're running our thumb pads through the client's metacarpals, just parallel to the metacarpals, giving them a nice little work. And then we're going to money sign up the fingers from distal to proximal. You would never want to pull backwards on the fingers. We always want Venus return, working towards the heart. Okay. We do a little bit of hand and foot massage. We're not trying to super increase the client's circulation here. Sometimes they're having a sweet session because they can't have that increase of circulation. Maybe they have some type of organ failure or something like that, where increased circulation might be harmful to them. But a little bit of hand massage and foot massage that's furthest from the heart usually shouldn't be harmful for somebody with CHF or something like that. It's usually okay. We're back to putting our pointers between the thumb and pointer finger and the client's ring and pinky finger. And then we're just going to slightly extend the client's carpals, and we have our thumb pads working on the client's palm surface again. Massaging away, circular friction, alternating, simultaneous, whatever works best. Now we're going to place our pinky fingers between the client's thumb and pointer and ring finger and pinky, and we're going to use our thumb pads again to practice circular friction in the client's palm. Give them a really nice hand massage, get some friction to the palm here. Okay, this is step number 12 on your sweet session. We're about 18 minutes into this 30. We actually recorded this for 32 minutes, so a little over halfway into the sweet session, working that massage cream into the hands. And we have completed step 12, which is the hand massage. Moving down, we're going to continue to move our chair down the sides of the table. I highly recommend sitting during your sweet session. Please don't stand while you're doing the hold positions. Trained licensed massage therapists are usually using their body weight. I'm standing here to avoid camera angles, but please make sure you're sitting. We're now going to do the hold over each thigh, the upper leg. This is step 13. You want to make sure you dry your hands off with a towel too after you've used lotion. You don't want to be applying your massage cream to the client's clothing after you've done that hand massage. You can ask your client to practice deep breathing again. And you can also practice through a blanket or whatever your client needs. I know when I was volunteering at the Miami Cancer Institute, there'd be clients I'd have 7, 8 blankets on them, heated blankets during when I was volunteering in the chemotherapy infusion suites. So they can get quite cold on the table. This client was actually warm. We recorded this in Miami, so that's why they don't have any socks or shoes on. But make sure the temperature is comfortable for your client. Now I'm moving the cameras down because we're going into step 14, which is we are going to do holds over the client's lower legs. I'm placing one hand each over the tibia, asking the client to take more deep breaths. Sometimes they will. If they're annoyed with it, I'll stop asking. My goal is to make the client comfortable and happy. And if they don't want to do something, we simply skip it. It's that easy. None of these steps are required. They could just simply lie there and enjoy whatever is going to make them happiest, whatever is going to make them feel best, as long as it's within your licensed scope of practice to execute. So you can see my hands are wrapped around the legs. We want to give full contact to the client. I have a little bit of cream down here because I'm going to use that for foot massage as well. So I have a single serve for this client. I'm never dipping into a larger bowl of massage cream. I take a little bit of cream out and I will use it for that client. And then I'll wash this bowl in between clients so that there is no cross-contamination from one client to the next. Now, even though this client is not getting undressed, I will also change the sheet in which they're lying upon, because that would be cross-contamination. Even though they're clothed, we don't want the next client lying on the same sheet that the last client lied upon. So that's really important. So we have finished our holds, step 13 and 14 on the upper thigh and on the lower leg. Now, if the client's feet are dirty, this would be your opportunity to use wet wipes or baby wipes or a hot towel to wipe off any debris, physical debris you see on the feet, or if, there's any type of odor, to try and hopefully wash some of that away. Okay. And from here, just saying hello to the feet, and I'm going into my last hold. I'm actually holding the client's feet up I'm not doing a traction or anything. This is simply a hold. I have my hands lying on the table and the client's feet are lying into my hands with full contact. I'm not squeezing or anything. And this is your number 16, holding both clients' ankles thereabouts, kind of more on the Achilles and the posterior calcaneus here. And this is the last time you might do a verbal affirmation during your treatment if you are practicing verbal affirmations with these holds. And it's a really nice execution for your clients to be able to lie there, enjoy, some nice relaxing time with another person. Something that feels good, something that's not invasive. Nice deep breathing here. Make sure when you're exhaling, you turn your head away from the client so you're not breathing directly upon them. We're going to go into step 17, which is ankle rotations here. We're going to rotate one ankle at a time. I'm holding underneath the calcaneus and Achilles while I'm taking a second hand and rotating using the ball of the foot and toes. And notice how I'm doing a little bit of dorsiflexion and plantar flexion with that foot as I go around in rotations. I'm going to rotate clockwise and counterclockwise. Our recommendation in our sequence here is anywhere from 3 to 10 rotations in each direction, but you choose how many rotations you do in each direction based on how long you have that appointment time for. Now, if somebody's fractured an ankle or there's massive swelling with maybe a pregnant woman, maybe you have toxemia of pregnancy, you might not manipulate and do this joint mobilization in and around the ankles with ankle rotation. It's your choice to determine what your client is indicated and contraindicated for. Okay. So we're finishing up on our second foot here of ankle rotations. Clockwise and counterclockwise. Doesn't matter which direction you start your rotation in, it doesn't matter. This is not a reflexology session where you might start on one foot versus the other. This is just working on the feet during this sweet session body work. Okay, so that's step 17. Now we're moving into step 18 and we're doing some light strokes around the malleoli. If you want to apply some lotion to do this, you can, or you can work dry. We're doing just some tracing with our finger pads around the lateral and medial malleolus of 1 foot at a time. You can do this simultaneously. You can alternate back and forth, whatever makes most sense and is more relaxing to the client. Simultaneous might be more relaxing than alternating. Alternating might be a little bit more vigorous. So whatever you think your client is going to enjoy best, that's what you're going to do. Your goal is that the client will enjoy it so much that they'll book another session, right? So we've moved over to the second foot, tracing the ankles again. This is our bone tracing activity, similar to when we were doing the mandible tracing up on the face. We're tracing the ankles now. I'm going to work in clockwise direction and counterclockwise direction. And just like most of the other strokes here, you can practice this 3 to 10 times or more, depending on how long of an appointment you've booked for that client and how long you will provide that sweet session bodywork appointment for. You want to make sure that you have nice firm contact without too much friction on the skin. The client should feel it, but without pressure. You're never digging in your sweet session. Now we're going to go into a medial petrissage. This is also known as a spinal twist in foot reflexology. And we're going to petrissage all the way down to the posterior calcaneus and up to the medial big toe, back and forth. These are the spinal reflex points. In reflexology, your cervical spinal reflex points are in the big toe. Your thoracic reflex points are from the base of the big toe all the way down to the top of the heel. Then your lumbar reflex points would be from the top to the bottom of the heel. Moving over to the second foot, this is step number 19 of your sweet session. We're we're petrissaging the medial foot here. Back and forth. Petrissage is one of those staple strokes of Swedish bodywork. Feels really nice. And we're not doing full body massage here. We don't want to get the circulation going. Usually sweet sessions are good for people who are contraindicated for increased circulation. We'll just do a little bit of massage with that petrissage there, and we're pretty much done with that. From here, I'm just doing some brushing of the feet. And I'm actually brushing with Venus return towards the heart because I'm still like using the massage cream almost in like a massage stroke here. Energetically, you could also brush backwards towards you from superior to inferior to try and wipe off any negative energy of the body. In this case, I'm doing more of a medical body brushing by working up towards the heart. Okay. So you're going to do whatever makes most sense for you and your client. And we're just adding this in here. You can alter your sweet sessions and add and subtract and do whatever you think your client's going to enjoy most, as long as you have time for it. Now we're going into our soul press here. This is also known as a lung press in foot reflexology. We're taking the palm of our hand and pulling on that dorsal foot, pulling the client's foot into plantar flexion, and then pushing the first knuckles of our fist over the client's ball of the foot, pushing that foot into dorsiflexion. And this is some more joint mobilization where the ankle is flexing and extending, plantar flexion and dorsiflexion. You want to make sure the knuckles just stay over the ball of the foot, and make sure you don't have any bone-on-bone contact. It should be all soft tissue. Now we're just going to place our thumbs into the solar reflex points in reflexology, which is about a third to halfway down the foot. It's kind of where your solar plexus is in the middle of the body, same as the middle of the foot. And I usually have the client take a nice deep breath and exhale. And as they exhale, I'm releasing pressure, releasing pressure, releasing pressure, releasing pressure. When your thumbs come off the foot, the client might not even realize you're no longer touching them. It's kind of a cool technique, that little solar plexus hold at the end of the treatment. Now I've grabbed some antibacterial wipes here, and I'm going to wipe the excess lotion off from the client's feet, specifically off from the soles of the foot, because we don't want them to get up and slip and fall. Usually you're working on medically compromised people during a sweet session, and they might have balance issues. So it's really important to get that excess lotion and cream off the feet. And you don't just want to wipe it with a wet wipe or a wet towel, because then you might have a wet, greasy foot. After I've wet and removed some of the residue with whatever's wet, your wet wipe, baby wipe, hot towel, or so forth, I'm going to use a towel to remove the remaining residue. Okay. It's very important that you get that residue off the feet so that when they become weight bearing and ambulatory again, they're safe. You notice how it's a little bit vigorous with the rub, and I'm also working between the toes, especially in Miami. People come in with flip-flops and sandals all the time. We don't want them slipping around with that. Alternating with this foot rub here is usually a little bit more vigorous to the client. It's kind of like waking them up. It's like, okay, we're about to get off the table now. So it's, getting them prepared to be back into their conscious selves so they can be brought back to reality. So from here, you've pretty much completed all the steps of your sweet session. There's many different closing rituals you might have during your sweet session. We usually like to do something called a body brushing, and that's where we're going to place the backs of our hands together. And we are going to start at the manubrium and then slide out laterally, go down the outsides of the arms, the outsides of the legs, and then brush the energy off the soles, the tops of the feet, the dorsums of the feet, and usually towards a window or door, literally brushing energy off the client. And that's how we might body brush in your sweet session to complete the session.